Hi, my name is Amanda Perez. I'm a recent graduate of Open Door Christian School in Elyria, and I will be a freshman at Lorain County Community College this fall. This summer, I was at Fairview Hospital in the heart clinic. The title of my project is Intravenous Iron Therapy, Managing Anemia in an Orthopedic Patient Population. We're going to start off with the introduction. What is anemia? Anemia is a blood disorder that occurs when a person has a below normal level of hemoglobin or hematocrit. Hemoglobin is the protein carried by red blood cells that is responsible for the transport of oxygen to the body's organs and the transport of carbon dioxide from the organs to the lungs. The hemoglobin protein molecule consists of 4 globin subunits in which each subunit contains a heme group. Each heme group contains an iron atom. The iron atom is essential to hemoglobin's capacity to bind oxygen. The most common type of anemia is due to a lack of iron in the body system. This is known as iron deficiency anemia. What causes iron deficiency anemia? It has multiple causes, including a low iron diet, poor gastrointestinal absorption, or bleeding from the digestive tract. In the absence of iron, hemoglobin is unable to transport oxygen in the body, does not receive the necessary amount of oxygen it needs. Anemia is a very important concern for all surgical patients throughout the entire process. Anemia needs to be viewed as a significant clinical condition. Studies have shown that anemia is present in 56% of patients prior to surgery and up to 90% postoperatively. High blood transfusion rates, postoperative infections, poor physical functioning and recovery, and increased length of stay in the hospital and mortality are all risks that have been identified in a review of literature by Svan. Preoperative anemia introduces challenges in the intraoperative and postoperative setting and is frequent in patients undergoing orthopedic surgery. The clinician's primary goal is to examine the implications for patients with iron deficiency who are undergoing major orthopedic surgery. An enhanced understanding of these implications will foster the clinician's ability to optimize the therapeutic approach to managing anemia preoperatively, and ultimately, this will help to reduce morbidity and mortality in this at-risk population. Now the objectives. Our objectives are to better prepare future researchers with the proper information needed to help the heart clinic assess and treat anemia patients who are receiving intravenous iron before major orthopedic surgery, and also to develop a tool for data collection to be utilized in repertory blood management outcomes while improving the patient experience. Now the methodology. A retrospective review of the literature was done, and keywords were used for the search such as iron deficiency anemia, preoperative anemia, Venofer, and iron therapy. Preoperative anemia is emerging as a common and important public health issue. Anemia is very frequent in patients undergoing major orthopedic surgery. Now to the data. Careful planning for any orthopedic surgery can help reduce blood loss and decrease the need for blood replacement. The operative planning begins with the preoperative visit. A careful history and physical examination facilitates early identification and treatment of anemia. Now on to the variables that need to be considered with the questionnaire. Baseline demographics are very important. The largest study has shown and suggested that there were possible gender differences. The prevalence of preoperative anemia increases with patient age and higher in men than in women. Baseline vitals, comorbidities and history of past iron therapy, past surgical procedures, anticipated blood loss, any signs of acute bleeding, such as GI and menorrhagia. Morbidity and mortality after surgery. Preoperative anemia is important because it is the strongest predictor of transfusions of blood components likely to increase morbidity. Hemoglobin and hematocrit levels. Most levels are measured before surgery. A few studies have shown the implications of reduced hematocrit levels in non-cardiac surgery. Initial ferritin and B12 levels. Post-surgical variables that also need to be considered. Post-operative hemoglobin and hematocrit levels, ferritin level, and the medications, including IV iron and erythropoietin stimulating agents. The conclusions. Patients undergoing major orthopedic surgery need to be tracked and analyzed closely throughout the entire process. A data collection tool is necessary in order to help clinicians identify patients' needs in relation to pre-surgical treatment of anemia. Blood management staff need to follow patients postoperatively to evaluate the outcomes of pre-surgical interventions. We recommend that a data collection tool should be created to assist staff in collecting pertinent clinical data applicable to the orthopedic patient population. A careful history questionnaire should be made for orthopedic patients to reinsure their safety. Here are the references that were taken. And I would like to thank Deanna McLeeson, Sherry Apathy, and the Heart Clinic staff at Fairview Hospital for all of their great help, and Mario Scarsapino for helping me with this project. And lastly, I would like to thank the Office of Civic Education Initiatives for giving me this great opportunity this summer. Thank you.